Okay, and we've got about 17 participants. And again, feel free to use the chat feature. I'll be monitoring that, and so will Amanda. So first off, I am going to go around and just uh, every once in a while we'll get a kind of an echo. So we'll have to mute a couple of people here and there. So if you want to ask a question, just remember to unmute yourself. Now that'll be on the window that you have there on the bottom left part of your screen. Usually there's an unmute and mute function over there. Just make sure that that crosshatch is off of your microphone and that'll allow you to speak. But for right now, just to reduce the echo, I'm going to mute people as we come up and we're hearing this echo. Okay. So I'm going to give an overview of what COVID-19 is first, real quick. I know most of us know what that is, and then I'm going to give an overview of the vaccines themselves. Hopefully that answers a lot of our questions just right off the bat, because a lot of these things have been asked prior, and it's important that we kind of go over those things so you got all that information, and some of those questions will be answered automatically. So number one, what we do know is that COVID-19 is a virus. It's a respiratory virus. So that means that it's transmitted by both droplets. And what we know now, which we didn't know completely before, is that it's also transmitted by aerosols. Aerosols are smaller than droplets. They're a little bit more difficult to keep contained, and they happen in more dry environments. But certainly the viruses are able to transmit through the air. And we know that the virus generally transmit from person to person and not from contact with surfaces. Initially, there was a lot of contact concerns that said that we were going to have difficulty with touching surfaces and then transmitting the virus that way. That does not seem to be a major concern at this point in time. The biggest route of contact with the virus is actually from a person, even when they're talking, breathing normally, and just because they're in close proximity to another person. And that's why it's been so difficult in these kind of environments, especially in communal living environments, to keep the virus under control and to keep it from spreading. So one of the things that we want to delve right into is how do we get this under control? Well, we've tried a lot of different measures, certainly masking, which I'm in my office with a closed door here right now, but usually I'll be wearing a mask pretty much all throughout the day. Masking is one of the big steps that we do to control the virus's transmission. We know that a mask creates a moisture-rich environment that prevents aerosols from being formed, and because of that, prevents someone from transmitting the virus to another person. But it also prevents the person that has the mask on from getting the virus from another person. So that's one of the big steps that we've taken. Of course, other steps like testing, but the next thing that we really want to get to is vaccination. So why vaccination? Where did it come from? I'm going to give a brief background to that because we want to really delve into the overall information about these vaccines. Vaccination's been around for hundreds of years. It used to be that we took samples from a person who was actually sick and used those to actually expose a person to an illness, a light version of the illness, and then that prevented that person from getting the severe illness. So step forward a couple of hundred years, and we started to actually make versions of a virus or bacteria that weren't as infectious, that didn't contain portions that would get the person sick or were inactivated. And those are the virus vaccines we hear about all the time, like the flu vaccine, where we actually take the flu virus and we give it an exposure to make the virus inactivated. It can't turn into live virus inside a person's body, but what it can do is it can teach the person's body about how to attack the infection. So the next time your body sees some virus get into your own cells, what your body will do is will actually go out there and attack it. So that's what the traditional vaccines do. And some of the vaccines that we're going to be coming out with later, such as the AstraZeneca vaccine, such as the Johnson and Johnson vaccine, these are going to be using those same kind of principles, although they're made in much different ways. They don't require eggs to be produced in many cases. And again, they don't require some of the same production techniques we've used for flu vaccines. Some of the vaccines that we're talking about today are different than those flu vaccines. And they use technology that, although it sounds very new, we've actually used for almost a decade for cancer treatment. So mRNA is what we're talking about here. So that's messenger RNA. So first off, you should know that messenger RNA exists throughout our body all throughout the day. If we didn't have messenger RNA, we wouldn't exist. So messenger RNA itself is not a problem. I think people really do get hung up on the fact that we are using something we haven't used before for vaccination. That is true, but the messenger RNA itself is something our body naturally produces. So I want everybody to know that that's something that's not unnatural to be in your body. And the other part of that is we are constantly using mRNA because it only lasts for a very short period of time. In fact, the COVID-19 virus itself uses RNA, but RNA is unstable. And that means that it breaks down in a very short period of time, which is also why when a person is at a great distance from another person, and or if a person comes into a room much later than another person, that virus is not going to be continued to be active because RNA breaks down. And that's why it's so critical that everybody know that the vaccine itself is not going to last in your body for a long period of time. In fact, that's really why we see the majority of the adverse reactions, like the body aches, the fever, the achiness of the arm site. Those things last about 2 days because that's how much time the mRNA is going to last in your body. It's only going to last for a short period of time and then break down. So unlike common medications that people are using, which can have long-term side effects, things like vaccines don't have those long-term side effects because they're not continuing to be in your body and you're not continuing to be exposed to them over and over. And I guess that speaks to one of the biggest concerns that people bring up about these is because they're new, they're concerned about things like cancer processes or long-term side effects. So these are not going to cause any cancers. They are not capable from a physiologic standpoint. So from a medical standpoint, they can't transform anybody's genetic material and they can't get the mRNA itself, the message that we're putting in your body can't get into the place where your DNA is. So it can't alter your DNA. So really from a mechanical standpoint, when we think about it, the vaccine has no ability to cause cancer itself. So the message itself. The side effects that we talk about for the vaccine, which I mentioned a few earlier, are very short-lived in nature. So the most common ones that we see are things like fatigue. Fatigue happens in actually a lot of people. And that happens in about 70% of people. And again, should last less than 3 days if you include the day of the vaccine itself. And fatigue, why fatigue and why body aches and why those symptoms? Well, it's actually showing you the vaccine's working. You're producing a little tiny bit of protein from that message that we're putting in. From that messenger RNA, your body uses its own machinery to produce some proteins. Your body recognizes those proteins and then goes after them. And the reaction that you feel is your body actually fighting that. It's learning what these things look like. And so it's attacking that. And so that's the same way we feel with, say, any vaccine. Namely, this feels a lot like when people get a shingles vaccine. When you compare it to, say, flu, it's very similar in that you may have body aches, you may have fatigue from that, you may have fever. And those are natural things to happen with vaccines. So that's not an unnatural process. One thing that people do have a lot of concerns about, and again, this is a very short time frame reaction, is shock or anaphylaxis. So when we talk about that, we are talking about any vaccine can cause that. And it can happen to normal things in the environment, such we hear about all the time, such as peanuts and avocados and other types of drugs can do that too. Vaccines are no different. When you introduce something into a person's body, there is a potential that a person's body will react in that way. Now, I think what we're hearing a lot of is, the message that's getting out with regards to having an anaphylactic reaction
Oh,
is
she
that
got
these
it.
are happening frequently. They're not.
I'm
This is
talking
not
to
a
you.
frequent reaction to the
I just
vaccine
brought it
itself.
on time.
And the good news is
I'll call
when
you
these
back.
clinics are being conducted, the people that are actually doing the clinics bring with them epinephrine, Benadryl, steroids, things that can be administered to a person if they do have that reaction. And to date, we have not seen someone who's had an anaphylactic reaction have any serious long-term adverse effects from that. They often are monitored at a hospital for a short period of time, and many of them, I think the vast majority, have actually been discharged that same day. And we've had very few numbers when it comes to anaphylactic reactions. And that gets me to who would likely have that. Well, it's a very rare reaction to have. The vast majority of people that have had that reaction know that they've had anaphylactic reactions in the past. And they've had them to other things, such as foods or such as other vaccines. And again, two of them that were in the United Kingdom already had EpiPens on them when they had that vaccine. So they administered that themselves. So anaphylactic reactions are more common in people that have had them prior. Now, does that mean that every single person is going to have had one prior? No, but it's far more common in people who've had them before. Other reactions that we tend to see are site reactions, such as pain at the site, soreness. My wife had that same thing. She had a lot of soreness at the site, and that's common for vaccines too. Again, that's short-lived. Hers only lasted for a day. Other things that we do see with vaccines in general, sometimes people get concerns about a condition we call Guillain-Barré. Now, we have not seen that as a typical effect of these vaccines, and over 2 million people now have received the vaccine in the United States alone. And so Guillain-Barré is something that can happen with vaccinations, but it also actually happens more commonly with natural infections in the community. One of the most common ones is a food-borne infection. That infection, called Campylobacter, causes the majority of the cases of Guillain-Barré every year. And in the United States, about 5,000 people annually get Guillain-Barré, and the vast, vast majority of those people did not have a vaccine. So any kind of exposure can potentially do that, but again, we have not seen that with this exposure. And that kind of speaks to another big concern that people have, which is that, oh, these vaccines have come out so quickly. And because of that, people say, well, they haven't been studied long enough. Well, again, that speaks back to these long-term and short-term effects or adverse
Can
effects.
you hear? Oh, yeah. Okay.
So when we're talking about that,
Oh, thank you.
vaccines themselves, those long-term effects are more things like Guillain-Barré potentially. Well, that happens within a short window of time. So if somebody's going to get that, it's within a 6-week period of time typically. And so studying a population that's received a vaccine for 2 months, you should catch all the cases of Guillain-Barré that are going to happen that were associated with the vaccine. Outside of that, there's really not long-term effects that we've seen from the vaccine. Most vaccine-related effects or problems are within a short window of time, and that's why the FDA said we have to have 2 months. And again, long-term side effects, these are just things that are more associated with things that are received on a daily basis, such as medications that we take every day. Now, with regards to the amount of time that it took to get these vaccines created, people have a lot of concerns for that too. Well, I understand that, but the problem with the way we made vaccines before is, number one, we have a lot more urgency right now. We understand that, and everybody understands that. We need to get a vaccine created quickly because we need to be able to control the current outbreak that's going on. But that doesn't mean that any of the normal steps were not taken. So we went through all phases of trials. phase 1 through phase 3, which is the normal regimen to go through for any vaccine. Also, they will do post-marketing information. So that means that people that receive vaccines will continue to submit information, and also healthcare providers will collect information on people who receive vaccines. So we'll continue to get more and more information about the vaccines themselves. But the good news is, since we had such high volunteerism for these vaccines, which is really unprecedented, we just don't see those with past vaccines in history. Since we had so many volunteers, we were able to study a large amount of people with these vaccines. The other part that's the unfortunate part is because we had so much virus and infection in our community, it allowed us to study this a lot faster. The reason that vaccine studies generally take so long is actually not because we're studying side effects or long-term effects of the vaccine. It's actually because it takes a long time for people who have received the vaccine to get exposed to the infection that we're studying. And that's not the case here. Since there's so many people that have had this infection, it takes a very short amount of time for us to figure out if a person that received the vaccine will not get the virus or will not have the virus symptoms when you compare it to another vaccine that we've already had. And that's generally what we're comparing to in these studies. We give not a placebo like a saline shot, but we actually give a different vaccine. And so when we give that other vaccine, say for one, it was the meningitis vaccine, we saw that it had no protection against COVID-19. Whereas when we give the vaccine that was supposed to protect against COVID-19 and the symptoms associated, both of the vaccines that are currently approved for emergency use in the United States showed around 94% or above effectiveness at preventing symptoms of COVID-19. And the real big deal is that even in those 5% that did have symptoms, the vast majority did not end up in the hospital. So that is the most important take home here, is that these vaccines are highly effective. They were studied in a large population of patients, and now they're studied in a large volume of people that have already received the vaccine and are continuously receiving reports about how they're doing. And the other thing is, again, the reason we were able to do it so quickly is because there's been so much effort by so many companies, governments to really get this out there. And because unfortunately, there's just so much COVID-19 in the population. And that really allows us to get faster information than what we would ever have before. So I do want to open up for questions, because I know there's a lot. If there's not questions that are brought up, that's okay. I've got a lot of different questions that have been brought up in the past, and I will start just kind of bringing up some information. But I do want to open it up for people to ask questions with regards to the vaccine, because that's what this whole thing is about. And if you're talking, just remember the left lower corner of your screen. In many cases, it contains a microphone. It'll have a red line through it if you're on mute. And so you can unmute yourself, or you can type in the chat, which is at the bottom of your screen, which already got a question there. So I'm going to answer that one first. So one question, what have you heard about the pregnancy and the vaccine? So in general, for vaccines, they're very safe during pregnancy. This vaccine itself has not had extensive studies in only pregnant women. And for that reason, we haven't had an emergency authorization just for that specific group. Now, having said that, the American College of Obstetricians and Gynecologists, which is the big group in the United States that says, are things safe for pregnancy, said we should not prevent pregnant women from receiving this vaccine. Why did they say that? Well, the big reason they said that is because COVID-19 can be worse for women, and certainly their unborn children, if they have that during their pregnancy. So it can result in, unfortunately, worse COVID-19, which is the actual disease itself. It can result in more people being hospitalized if they happen to be pregnant when they get the SARS-CoV-2 virus. And unfortunately, it increases a person's risk of dying. And for that reason, and because of the mechanics of the vaccine that we talked about, we really suspect that it's going to be a very safe vaccine during pregnancy and even during lactation. Now, we don't have long-term studies, of course, with that either, and we won't for quite some time. But having said that, the mechanics really agree with the fact that this is going to be a short-lived thing in your body. It's very unlikely to have any direct communication to the womb and therefore have any direct effect on the child. And we know that the risk of COVID-19 itself is higher than the vaccine. And so they are saying that, you should have a discussion with your obstetrician, with your doctor about receiving the vaccine itself. But if you do feel like you want to get the vaccine, you should be allowed to do so. Now, I will speak to, because you asked that question, which is a great question, I will speak to children in particular with this vaccine. There are ongoing studies for children. Now, you may know that the Pfizer vaccine has been approved for ages 16 and older. The Moderna vaccine has only been approved for 18 and older. And that's just because of who they studied in their studies. That really doesn't speak to, the specific age group being safe or not. It's just who was included in the initial studies. We are, again, Children's Mercy is actively conducting studies. We have many children's hospitals throughout the United States who are conducting studies for children. Why have they said that it's not safe? Well, again, they need to include those groups in the studies to make sure that we have good safety evidence, but every indication is that it will be safe for those groups too. And again, it's a great question on pregnancy and lactation. We do feel that those vaccines, if someone wants them, should be able to be received. Other questions, feel free to put in the chat, or if you actually want to unmute yourself and ask. What's the rollout schedule? Okay, so great question. So right now we have 2 vaccines that have received an emergency authorization for use. And those vaccines are the Pfizer-BioNTech vaccine. So that was 2 different companies who developed that vaccine together. It is available now to healthcare workers that are on the front lines and also to long-term care and assisted living residents. So those are able to receive the Pfizer vaccine right now. The same thing has happened with the Moderna vaccine, and it is part of our initial rollout. So you may have heard these terms 1A and 1B, and then states have their own rollout schedules depending on how much vaccine they have available. So it is complicated. Every state's a little bit different. For instance, in the state of Kansas, right now, we've heard of many facilities now receiving their dates for their initial vaccine clinic, where actually the Walgreens or CVS pharmacists will come to the facility and actually vaccinate people there. For the hospital staff, they're going to do that directly at the hospital. But those are the 2 vaccines right now that have received authorization. And we will have more. So there's going to be more vaccines coming down in the near future. As you may have heard today, AstraZeneca, one of their vaccines that was developed with Oxford University, received approval in the United Kingdom. And we anticipate that will receive approval in the United States as well. The effectiveness may be slightly less, but we do feel that that is going to be a good vaccine for the general population as well. It's off of a little bit different technology and an older principle, which we've used for a long time, which is basically put an inactivated virus, a virus that's not capable of giving you COVID-19 or making other viruses in your body, but putting that into the body instead of just a little bit of instructions from the virus. But again, we anticipate that one, the Johnson & Johnson vaccine, to become available. And those are far more likely to be seen at your local doctor's office because they don't have to have such cold storage. They're much more stable in the environment. And therefore, the doctor's offices will be able to handle those a lot easier.
What is this?
And, Amanda had pointed out she had received her Moderna vaccine today. I myself received my Moderna vaccine today. My sister, who is a surgical technician, had received the Pfizer vaccine 2 weeks ago. And then my wife had her Moderna vaccine a week ago. And I say this not to say, congratulations to us for receiving the vaccine. What we're saying is that the people that have received it have done very well. My sister did feel fatigued for about a day, and that was it. Then she was back to normal. My wife, the only thing that she had was soreness in her arm, and then she was back to normal. And that only lasted a day for her too. The effects, the adverse effects, such as the soreness and the body aches and sometimes fever, are lesser actually in those that are 65 and older. We did see that in our studies, which is great news. So for our older population, we see less of these kind of adverse effects. We tend to see more of the symptoms after the second vaccine. I think it's important to know as well that when you receive the vaccine, you're not immediately immune to COVID-19. We do see that, and there's some initial reports that you may have up to 60% protection from the disease COVID-19, but unfortunately, we don't have enough evidence yet to say that it doesn't transmit the virus to other people. It doesn't allow you to transmit the virus to other people. Now, I will put a caveat on that, is that pretty much every vaccine in history has prevented some level of transmission. Now, always vaccines will work in the way that you'll get exposed to the virus the next time after having the vaccine, and your body will recognize it immediately and get rid of it. There may be a short window of time, and this may be for any kind of virus, that you may be able to transmit the virus. And that's what we're looking into still. Moderna put out a little bit of information about that to say that, hey, it doesn't look like people are able to transmit the virus, which is great news. And we highly suspect that that will be the case. And that'll allow us to get back to more normalcy over this next year, where we're not having to wear all these N95s or KN95s, but we can't say that yet. So we are advising people to continue their same precautions even after receiving the vaccine, and especially after receiving only the first vaccine. You need to have the second vaccine of any of these vaccinations that are out, and the ones that are coming, for the first one, AstraZeneca will be 2 shots. Johnson & Johnson may be 1, but you'll still need a period of a couple weeks afterwards to get to your high effectiveness of 95% or whatever the effectiveness of that vaccine is. And a couple of more ones that got asked. So we have residents concerned about this being FDA approved. Are they both FDA approved? So there's a difference between FDA approved and emergency authorization for use. And I think it's important for us to make that distinction because a lot of people are okay with receiving medications that have emergency authorization for use. You may have heard about these monoclonal antibodies that we are giving to people as infusions if they've gotten COVID-19. Those have emergency authorization too. And so a lot of things right now when it comes to COVID-19 treatment and vaccination, we'll get initial authorization and then we'll get full approval pretty shortly after that, we feel. And there's just going to be a period of time where they're going to be under emergency authorization only. And then once we have even more information from the vaccine follow-up, they'll be fully FDA approved. At that time, there may be some changes in how these vaccines are required by certain workplaces. So right now we're saying, okay, we understand, this is a new vaccine, although we highly, highly recommend everyone receive it. We do anticipate once that is fully approved, that there will be some changes to allow for really more encouragement to receive vaccine. And let's see, why is the vaccine causing more symptoms in the younger population? That's a great question. So the reason that happens is how our immune system reacts to what's being presented to our body. Unfortunately, there are good things to how our young immune system works, and there are bad things to how our young immune system works. And one of the good things is we usually attack things very quickly. One of the bad things is sometimes we kind of overdo it. And that's what happens here. We kind of make more chemicals, more of the proteins that make us have fever and achiness than we would as we age. And so there's some positive things to having a mature immune system too, which is what our older population has. Some of our older population out there, they have a very mature immune system, and it's not going to, say, overreact to something such as this. I'm simplifying that far more than I don't want to make it too complex, because immunity is such a complex topic. Unfortunately, even immunologists don't understand everything with regards to immunity, but we know a lot more even over the last 10 years or 20 years than we knew over the last thousands of years. So we know a lot about the immune system. It's just that we do know that older populations don't have that kind of overreaction that you sometimes see with the body. And that doesn't necessarily mean that younger populations, such as children, will react in that way either, though. They may not react the same way as a 20-year-old, more likely because they have an underdeveloped immune system.
Okay.
As we're seeing with a natural infection,
Nope, I'll
that
take it.
the younger population will have
You're
less
welcome.
adverse effects too, that they'll have less reactions to
Yeah.
as well. That doesn't mean that
You're
the
welcome.
vaccine is any less effective. The reaction that you're seeing, the adverse effects that you're seeing, are actually that first part of our immune system. I call it the club part of our immune system. It's that primitive part of our immune system that just goes in and says, I'm going to try to raise your body temperature and kill this virus, and I'm going to do everything that's really not very surgical and not very specific. What we're trying to do is we're trying to bypass that. We're trying to say, hey, no, I'm going to go to the more specific part of your immune system.
Bobby, you need to go back over there. Be nice.
Okay, those are great questions. Other questions that people have?
Dr. Sears, can you speak to the reasoning behind why we as a society, the CDC, the government, why are they targeting long-term care facilities and healthcare professionals right now? I guess, what's the end game? Why, can you explain the logistics and the thought behind that, and why we are encouraging so many people to get this new vaccine all at once, and what that would accomplish?
Yeah. So I think, and what you're getting right to is a concept we call herd immunity. Now, herd immunity, people probably heard that a lot recently. There is the nationwide herd immunity, worldwide herd immunity, and then there's local herd immunity. And what we're meaning there is we are trying to get entire buildings to be protected against COVID-19, so that if we get 90% participation in a community such as Evergreen, we get 90% of people vaccinated, even if one person were to get sick, it wouldn't spread from one person to another. That's the whole principle behind getting as many people vaccinated as possible. Now, you remember I talked about right now, we're not certain that it can prevent transmission. But again, if it operates like all these other prior vaccines, the very likelihood is if it doesn't prevent it entirely, that it will shorten the amount of time that you can transmit. And that will really protect these communal living environments that we have. And it's important for healthcare workers, such as Amanda was pointing out, to get vaccinated, because we're the person that could potentially transmit. We're that unfortunate person that might be asymptomatic and then go into a facility and unbeknownst to us, transmit the virus. So we need to make sure that everybody that is at risk of having severe symptoms is protected by having the vaccine. And then we also need to make sure everyone that's at risk of transmitting the virus gets the vaccine on the very, very likely chance that this will prevent us from transmitting to another person. So it's about herd immunity, and it's also about protecting and keeping those people that get coronavirus from being severe infection. And that's what these things do best of all, is they prevent a person from getting coronavirus and having a severe case of COVID-19 and prevents them from going to the hospital, which is what we all want. Another one that had been brought up that I did want to bring up, and a lot of people have brought up to me, is questions of fertility. And I want to really emphasize this one here. This is a complete rumor. It's a complete rumor. And that is something that got brought up on the internet, and it's likely based on a retrospective study. That means a study where you look back at people that had the virus in this case, not the vaccine. So they were looking back at people who had had COVID-19, and they were particularly looking at males only and what their actual sperm counts were. And that was it. That was the only thing they were looking at. And they were looking at it for a very short period of time. And we know already that people who get sick have a decrease for a short period of time in their fertility. We know that. So that's not something that's new information. That has nothing to do with the vaccines themselves. And again, I want to emphasize, when we receive a vaccine such as this, especially, the vaccine's going into the muscle, and then it's being picked up by a few of your cells in the muscle, and you build this protein. And then your cells display the protein to your immune cells. Your immune cells then bring that down to your lymph nodes in your arm area, and that's pretty much where it stops. And again, the achiness that you're feeling all over is not what's happening from this mRNA that we're putting in your arm. It's from your body's reaction to that. So this thing stops right about here in your axillary area here in your armpit. And that's where it stops. So again, it really doesn't make sense from a mechanical standpoint that this would have any effect on reproductive systems, because it's just not going to get to that place. And then a question on, when do you anticipate families being able to get back into communities? So the important thing about this that we're just talking about when it comes to herd immunity is the more people we can get vaccinated, the more likely we can get families back into the community to see their family members. I mean, I can't emphasize that enough. If we have communities where we have 40% of people who receive the vaccine, that's simply not enough. And it won't be enough when the Centers for Medicare, who really gives us the guidance on when we can open back up to visits, they're going to set some standards. They're going to say, you need to have this many people vaccinated. And if we don't have that percentage, we're going to have a really tough time getting families back into the community, because the worry is going to be, okay, we've got 40% of people that are protected, but what about that 60%? What if that 60% didn't consent for this person's family to come in and they had COVID-19 and then they got sick? And so we really need to have high percentages of vaccination. And it speaks to another concept that I'm seeing a lot of right now, which is the I'll wait and see. I'll bypass that first clinic and go to the second clinic. I really don't advocate that for people. We have seen over and over and over that 2 weeks, 4 weeks especially, which is the amount of time it takes between the Moderna vaccine, the first and second dose is 4 weeks, and the Pfizer is 3. A lot can change in that amount of time, a lot. And what I mean by that is we can have an outbreak completely go through a facility in 2 weeks. It doesn't take 3 or 4 weeks. And so if we don't get enough people vaccinated early on, we are still at risk of major outbreaks happening. And none of us want that. And I know, people are always afraid of new things, but this is something we've been doing for a long time. And as I said before, this is not a new technology. We've used it in cancer treatments. These are things that we have used. Now we're just using them in a new way for vaccination. And in a way that we can actually, I find this way to be the future. This is the way that vaccines are going to be made in many cases from now on, because of the speed in which we can make vaccines and respond. We're outsmarting the virus right now. That's how we outsmart. That's how we win against a virus that, has no other thought but just keep on replicating. So we've got to beat it with our, brains and our technology, and that's how we do it. So it's a great question about when do families get back in. And the other question that goes with that always is, when can I take this mask off? And again, that really depends on Centers for Medicare and Medicaid Services. They are the governing body for the nursing care centers. They tell us what we should and shouldn't do. Obviously, we give advice in the meantime when there's less advice on certain subjects. But for that, they're going to continue to advise mask wearing until we really get vaccinations to be very prevalent in the facilities. And again, I think what's probably going to happen is they're going to say, if you have a certain percentage of your facility vaccinated, I do think they're going to start to allow for certain things like mask wearing to stop. And or my biggest concern is that people that haven't received the vaccine will have to continue to wear their mask while COVID-19 is still circulating in the community. And so for staff members, and we've seen this with flu, we know this happens commonly in the wintertime with flu, is that people who have not received the flu vaccine, CMS will mandate or suggest that they have to wear a mask the entire season while flu is still circulating to protect those people in the nursing care facilities. So I anticipate that'll be advised for people who have not received the vaccine, and not out of punishment, but out of the realization that those people can still potentially transmit the virus. Is something you can require is this something you can require the employees to receive? So right now there are, there is a potential that facilities could do that. They could say, you have to have this vaccine. I don't think that there's any facilities that are saying right at this moment that you have to have this vaccine or we're not going to employ you. There is a potential in the future, again, when FDA authorization, when the full authorization comes about, that from a legal standpoint will actually change things quite a bit and will potentially allow facilities to require the vaccine to be given in order to work in the facility. And I think, again, we don't want it to be that way. We don't want to mandate it. We want everybody to want to get the vaccine. I mean, this is how society gets back to normal. This is how society gets back out of this. We want people to want this thing. Other questions that people might have, and again, feel free to unmute yourself on the lower left-hand corner or ask questions in the chat there. And again, all great questions. And I can ramble on about vaccination forever. Amanda definitely knows that. I think that there's a ton of questions that we don't think about while we're talking that you may think about later. I want you to feel free to ask those. I'm going to go through just real quick. One other item is that if after you've received the vaccine, if you have respiratory symptoms, and what we mean by that is if you have cough, shortness of breath, if you're having loss of sense of taste or smell, or even runny nose, and you've already received the vaccine, that is not a side effect of the vaccine. That is something that needs to be investigated. It needs to be reported to your supervisor and may warrant getting tested for COVID-19. Things that are normal are things like body aches, fatigue, fever, generalized aches in your muscles or joints. And again, these are things that we anticipate happening in normal vaccination. Any other questions that people might have right now?
Probably not. I mean, look, Josh Hawley is a bright guy.
Yeah, and I think the other thing is we don't want this to be political. This is not a political issue. It's not at all. It shouldn't be treated as such. And anybody that's out there saying that, again, if they're giving information out, but they don't have sources for that information, especially if it's simply just titles and any more on social media, we really just have to be really watchful. Go to the CDC's website. Feel free to ask your supervisor who can ask us. We'll be happy to answer these questions. We want to answer these questions. We may not know the answers to everything, but we're not going to put inaccurate information out there. And I want to really speak to that because there is so much inaccurate information circulating. And again, many people have, although they may not have direct profit from it, they may get something out of it. They may get notoriety or fame, or maybe more views on their social media, and that may get them actual reimbursement. So you have to remember there's reasons that people put some of these informations out or pieces of information out there, and often it's not in the best benefit of the population as a whole, or it's based on, you know, a bit of experience with something that's completely unrelated. You know, again, 2 million people have received this vaccine in the United States, but no one had received this vaccination prior to it being approved. So no one knows, based on any prior vaccine, you know, how this is going to do, except for what we've studied, which is that this is a very safe vaccine. And when you compare it to COVID-19, there's no question. There's just absolutely no question at all. I would get this vaccine 15 times in a row. I got it today. Like I said, you know, my family is getting this vaccine. The instant my mom can get this vaccine, she's going to get it. The instant my niece is going to can get this vaccine, she's going to get it. I mean, it's just not an option in my family because we know how protective it can be. And we know that it can prevent people from having severe disease. And we're very likely that it's going to prevent people from passing it along. And those people that get it will then be able to get back into society like they want to. Well, I want to thank everybody for being on with us today. Again, I apologize for the Facebook session we were supposed to have. Something just completely broke down on my account, and you know, that's my fault. But certainly we will try to make that better for the other session that we have. I believe we still have one scheduled here. So if hopefully we can get that going, and if not ahead of time, then we'll put out more communication. We'll get this Zoom going again. But please keep asking questions. I don't want anybody to sit back there and say they're not going to get the vaccine because they didn't know this. There's just no reason for that. Amanda, do you have anything to say before we get off here?
No, thank you very much, Dr. Sears.
Great. Well, thank you all, and have a good day, and go get vaccinated whenever it comes around to you, okay? And I'll stay on if anybody has additional questions as you're dropping off. I'll stay on for the next 10 minutes, but everyone else have a good day, and go, you know, again, please let us know if you have questions.